Good afternoon, everyone. Myself, Dr. Nikita Vekhande, MD Chikitsa, and the core team member of the Gurukul Global Academy. It gives me good pleasure to welcome you all for the today's clinical meeting. The mission of Gurukul Global Academy is to build the future of healthcare. Each learning experience here is designed to shape the Ayush doctor into globally completely professional with strong ethical and academic foundation. Today's session focuses on unique and thought-provoking topic, Yukti Satvavajay in psychiatric disorder. We are truly honored to have with us Dr. Cyril Kadam sir, a distinguished clinician, researcher, and scholar in the field of Ayurveda. On behalf of the Gurukul Global Academy, I extend a warm welcome to Dr. Cyril Kadam sir, all our respected teachers, fellow doctors, and the students who have joined us today for today's meet. Before we start meeting, I request everyone to join me in Dhanvantari Savan to seek his blessings in our clinical practice and discussion.
नमामि धन्वन्तरीरादिदेवं सुरासुरवन्दितपादपद्मम् लोके जरारुक् भयमृत्युनाशम् दातारमीशम् विविधौषधीनां शङ्खं चक्रं जलौकान् दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसच्चारु पीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवन् प्रौढदावाग्निलीलं प्रौढदावाग्निलीलं प्रौढदावाग्निलीलम्.
Now I humbly invite to Dr. Datta Bapadikar sir to continue the further session.
Thank you, madam. Thank you, Dr. Nikita, madam. Before starting our today's clinical meeting, let me brief about the Gurukul Global Academy. This is a medical education platform where we are on mission of building the future of healthcare. We offer 25 plus super specialty courses in Ayurveda with the integration of Ayurveda and modern science. We hold clinical meetings, workshops, hands-on training, and conferences. Next. You can visit our website, that is the gurukulglobalacademy.co.in. You can WhatsApp me on 9969119134. You can also email us on thegurukul@parasnathclinics.com. Please join our WhatsApp group for more updates. Next. We offer you upcoming courses. These are the list courses. Next. Our today's clinical meeting on topic of the Yukti Satvavajay in psychiatric disorders, and our today's guest speaker is Dr. Cyril Kadam sir. I welcome you, sir. Next. It is my honor to introduce our today's guest speaker, Dr. Cyril Kadam sir. Sir has done BMS from Ayurveda Mahavidyalaya Savantwadi. Sir has done PG certification in clinical Panchakarma from Gokte Pratishthan. Sir also has done PG certification in interpretation of ECG, 2D echo and cardiac labs. PG DBA in finance, advanced PG diploma in business management, Lean Six Sigma black belt, TTT in mindfulness and project management training. Next. Sir is holistic neuropsychiatrist with 32 years of clinical experience leading Genesis Positive Health Mind Care clinics at Thane, Mumbai, and Pune, offering integrated holistic mental health care with Yukti Satvavajay, including Panchakarma, Shaman Chikitsa, Yog, CBT, REBT, social integration, emotional intelligence, life coaching. 25 years of corporate healthcare leadership with healthcare multinational companies leading worldwide, clinically quality efficiency. I welcome today's session to start. Over to you, sir. Dr. Cyril Kadam, sir.
Hey, good afternoon. Am I audible?
Yes, sir.
Okay. Thank you for inviting me for this session, and it's an honor to be taking part of such clinical meetings arranged by you. Let me share the presentation. Let me know if you're able to see it. Is the presentation visible to all?
Yes, sir. You are audible and visible, sir.
Okay. Thanks a lot. So thanks, guys, for joining this session. We would like to discuss primarily on the neuropsychiatry aspect. While we know India has become a hub for metabolic disorders, but the globe is now haunted by neuropsychiatry and psychiatric disorders more than any other. The burden of illness from a perspective of psychiatric disorders is much larger than what we perceive. And unless and until we actually undergo these things to the level that it disturbs our daily lives, we tend to ignore any simple symptom which relates to psychiatry. More importantly, how psychiatry is different from any other infectious or a metabolic disorder is a metabolic disorder like diabetes would disable or probably give me more discomfort at my personal life level. So I am affected, partially my family is also affected. But in a mental disorder, I am affected, but at the same time, in the same quantum or probably more, the family is also affected. So that's how it's much more different. The dynamics are different in a psychiatric disorder. Today, I wish to present my views on the way that I've been practicing neuropsychiatry from an Ayurvedic perspective, but making sure that we integrate both the knowledge bases, that is the in vogue reductionist science, that is allopathy, along with our Ayurveda as well. Okay. Please feel free to ask me questions in between as well. But if the norm is such that we need to wait, we are okay. Just pen down questions. Let it be as silly as possible. I'd like to hear from you. It will be more of a participatory sort of session than me talking to you. Let us all talk to each other and we gain from each other. So I'd like to run today's session of whatever 45 to 50 minutes in this format. One is what do you mean by neuropsychiatry and the introductory basic elements about psychiatry, neuropsychiatry. Next, what are the limitations of the current or in vogue allopathic approach towards psychiatry? The third part is obviously what is Yukti Satvavajay, the Ayurveda's offering towards neuropsychiatry. Then we'll discuss three cases related to what we have our talks earlier on. Are we good? Should we go ahead?
Yes, sir.
Okay. Anyone from the team? I don't like silent audience actually. I've been teaching for the past 25 years. Okay. I've been
Yes,
having
sir.
courses also. So if you see the highlight of many of them are uploaded, so you can we should see them, access them. So do talk to me. Okay. That makes me more excited about sharing more experiences with you. So, neuropsychiatry, as the word says, there are two entities in that. One is neuro, second is psychiatrist. So, neuro, everyone knows it is related to the nervous system and the neuron, and all that stuff. Right? Psyche, psyche has come from a Greek origin, which means the soul, spirit, the mentality. Even it says the breath of life. Let us see how it relates to the actual psychiatric disorders and why was the word psyche uh, coined in the first place. So apart from Dr. Datta and Dr. Nikita, anyone else would like to tell me one word for this? Hello, am I audible?
Yes, sir, you are audible, sir.
No one wants to participate? You want a one-way delivery? I'm okay with that. 10 minutes, my session will be done. What do you see here? These are all unicellular organisms, right? Hello?
Yeah.
Yeah, so these are all unicellular organisms. I guess the topic is boring for people. Is it that Dr. Datta, you forced people to do an entry here? ऐसा तो नहीं है ना?
Not like that, sir.
Okay, great. So fine. It's okay if you don't wish to participate. My question to you is, I designed it in this format so that it's easy for people to understand, and so there is nothing called a wrong answer. Please do participate. It would serve the purpose. Where is the unicellular brain? Do you have any idea if there is a unicellular organism? Do you see a brain in that organism? Have you seen any organelle which works as a brain? Yes or no?
Amoeba, maybe?
Amoeba has brain, is it? Does
No
amoeba have brain?
organs, no brain.
No.
No brain. So anything relating to a brain or a structure or any element of the brain which is there in a unicellular. So if we do not see a visible organelle or probably something related to the brain, then how does it work? How does it live? How does it take decisions? It takes decisions, right? It has to take decisions. So it takes decisions. So if that is the case there, then why do we human beings need a brain? That's a question, right? There will be many questions that I'll put forth to you. Need not be answering it today, but over a period of time, my whole session of 35, 40, 45 minutes would want to create questions in your brain. Okay. Try to assimilate them and maybe answer to yourself over a period of next few weeks. Okay, and you may talk to me as well if you want any help in deep diving into this. So this was my question. Why do we need a brain? So most of the time when we say psychiatry, we say it's related to the brain, right? Everywhere you see the brain. Psychiatric disorders is brain. So is brain the mind? Is brain the soul? Is brain the spirit? What are your thoughts? Anyone wants to connect on this?
Mind?
Nothing from this.
Nothing from this, right? So we still will study the brain and the nervous system to understand neuropsychiatry or psychiatry. So there's an intriguing feature here, which is a highlight and the hallmark of reductionism. Okay, reductionism is a way of looking at science or the protocols that are used to understand the universe around, where one phenomena is linked to one reason, karya karan bhav. But there is only one reason. There is only one causative factor, which matters the most. So you relate to it, and then you find out a solution to that. That is primarily the reason why there becomes another group of sciences which are called as holistic science, where we define there are multiple contributory factors to one phenomena. And you cannot address only one factor to see a change in the phenomena. That's holism, right? And Ayurveda is a perfectly holistic science, right? So by analogy, we get to know that cell has memory. And today it is established that this brain is not the center or the seat of memory. Brain is one of the parts where memory resides. Every cell in your body has a memory. The best example is your T lymphocytes, your immune cells. They have memory, right? They know which antigen, when they see, what to do with that antigen, right? So it proves that your cell has a memory. Then if your cell has a memory, then memory loss कहाँ पे होता है? Where is Alzheimer's? Where does Alzheimer's happen? Is it a cell phenomena? So after you do a deep dive in this, what actually it comes out is your brain is just a data center, which has many, many different servers, which has many huge amount of gigabytes, not even gigabytes, maybe terabytes, not even terabytes, beyond that. And each of them is connected. And it is a highly, highly super connected network of data servers. Each of them holding trillions and trillions of data files. Right? Now, if that is your brain, then where is the mind? The question still remains the same, right? Let us introduce one more concept called the gut microbiome. You must have heard about this, right? For a long time, it's been there. But recently now, I guess it's high time that the textbooks in the first year also get this refreshed at all the three levels. Gut microbiome is an important aspect. I don't want to speak much.
Alongside the cells that make up our bodies, there are trillions of microscopic organisms. It's not just the friendly bacteria in our guts that help us digest food. Bacteria live on our skin, in our mouths, and in the vagina. And it's not just bacteria. We're home to populations of viruses, fungi, and archaea too. When does this colonisation begin? Most scientists think we acquire our first bacteria when we're born, and before that, babies develop in a sterile environment. But recently, a few studies have found traces of bacterial DNA in the placenta and in the amniotic fluid that surrounds the fetus, as well as in meconium, a baby's first poo. Could this be evidence of bacteria living with us before birth? Maybe. But many scientists think these findings could be the result of contamination. There's an ongoing debate. Whatever the answer, everyone agrees that the first major colonisation occurs during and just after birth. Babies born by vaginal delivery get a dose of bacteria from their mothers as they pass through the birth canal. After birth, the baby acquires more microbes from the air and from contact with objects and people around her. As she grows, many factors influence the makeup of her microbiota: her diet, whether or not she takes antibiotics or other drugs, how many people she interacts with, whether she has pets, where she lives, and potentially also her genetic makeup. Children that live in rural areas surrounded by animals and dirt host different sets of microbes to children brought up in urban environments. If children aren't exposed to a wide variety of microbes, they seem to be more likely to develop autoimmune and allergic conditions such as asthma and eczema. This is known as the hygiene hypothesis, and it's one example of how our microbiota influences our health throughout our lives. By adulthood, our bodies contain as many microscopic organisms as human cells, if not more. Our physiology relies on these communities. For example, they protect us from harmful bacteria and help us digest food. As microbes break down food, they produce molecules called metabolites, which circulate in the bloodstream, reaching all tissues of the body.
You all must be wondering ये सब चीज ये साइकियाट्री में क्यों बता रहे हैं, right? इसके आगे शायद आपको थोड़ा सा यूटिलिटी समझ में आए.
Our metabolism. A diverse community of gut microbes contributes to a healthy metabolism. A less diverse microbiota is associated with inflammatory bowel disease, obesity, and type 2 diabetes. Some studies even suggest that microbial metabolites can affect the brain and influence our mental health. As we get older, our microbiota continues to change. Studies show that the gut microbiota of older people differs from that of young adults, potentially contributing to aging-related changes to our immune system and brain function. There's an awful lot still to learn about how the many microorganisms that live with us contribute to our well-being and influence our health. We need a better understanding of why microbes differ between people and how these differences affect our biology. And in particular, we need more studies of microbiomes in non-white populations.
So I have a question here pertaining to Ayurveda. The microbiota, as we say, which is there across your body, yours and mine, on the skin surface, in cavities, in your GI tract, in your oral cavity, in certain fluids of your body. How are they different? Why are they different between different people, between different geographies? You have to think about the desh. You have to think about the soil microbiome. That is where Ayurveda has gone beyond reductionism to holism to think even about the soil microbiome. even about the ecological exchanges, to base all of its tenets of medicine on one system, which is called as Vasudhaiva Kutumbakam. Okay, so that includes your changes related to genetics and your changes also related to epigenetics, because of which we are able to treat holistically. Okay, now related to this further is the special connection, not a special connection, but one of those connections which has recently garnered too much of attention, because there are many diseases which are refractory to the so-called today's available antipsychotic medications in allopathy. And they have started working on this concept, which is gut-brain axis, which says that the microbiota in the gut in three different modalities will influence the brain, the working, the physiology of the brain, the decision-making capability, the imaginative power, and your ability to stay calm and take wise decisions. That is called the gut-brain axis. Okay, I will move ahead. I will not want you to see this video. You can see that and you can ask me more about it. But just from a perspective of microbiota, you can understand this. When you are at an age which is very, from toddler to growing towards an adolescent, your gut microbiota is developing. The types of neurological disorders that you'll have will be different as compared to the next phase, which is your adult life. There, you have a high diversity of microbiota. What is diversity? Diversity is the different type of strains which are available, and how many different types of strains within a species, and how many different types of species within the various genera that are available. That makes you more strong and more confident to be taking care of immunity in all environments. Okay, so now you see in the early phase what are the types of disorders, and the later phase what are the type of disorders, where again your old age mimics your early childhood in terms of microbiota concentration. Another important aspect that we need to visit is about ARM. ARM today can be linked to a concept with what today's functional medicine talks about, is called as dysbiosis. Okay, this is an important element for neuropsychiatry to be understood from a holism perspective. So I'd like you to see this in depth and understand it.
Epithelial cells have tight junctions between them to ensure that no undigested food particles, digestive waste, or toxins escape into our blood and create health complications. Healthy epithelial cells are supported by a balanced microbiome of good and bad bacteria, which is supported by a nutrient-rich intestinal environment. Stress, poor diet, lack of exercise, and use of antibiotics can disrupt our microbiome and intestinal environment. These disruptions can lead to weak epithelial cells and loose epithelial junctions. Without tight junctions, undigested food particles, digestive waste, and toxins can leak out of our intestines and into our bloodstream, causing inflammatory immune responses, various digestive disorders, and changes to the normal function of the digestive tract. This is often called leaky gut. So what can you do about it? A nutrient-rich intestinal environment helps support a healthy microbiome, which helps support strong epithelial cells and tight epithelial junctions. Therefore, an effective way to help prevent leaky gut is to maintain a healthy, nutrient-rich intestinal environment. This can be achieved with whole food and plant-based nutritional intake, good eating habits, and lifestyle management techniques like stress reduction and exercise.
So why did we see this? Because if we now need to relate it to the holistic aspect of Ayurveda, where we say Yukti Satvavajay. Satvavajay includes multiple modalities of treatment, including the diet, including the vihar, ahar, vihara, and in general the charya, my lifestyle, which is going to affect my mental status. Okay, that was the reason for you to impress this. Now, understanding the triune brain is something critical for us if you want to treat these patients. From an anthropological or from a developmental standpoint of view, the brain we can understand from three different levels. The first is the basic level, which is called the reptilian brain, It is taking care just about the survival. That is your basic functions for surviving. That is your breathing, your heart rate, your fight or flight reaction, right? Reflexes. The next evolutionary part of the brain deals with your emotions, which is the limbic system. Okay, that gives you pleasure and pain, the reward system, the imaginative part. And the newest part on board for especially Homo sapiens is called as the neocortex. Neo is the new and cortex is the upper layer that is responsible for your reasoning, self-awareness, analysis, and planning. Okay, now this is your basis of understanding of emotions as well. And why do we have our mental disorders? That is a close coordinated effort between the nervous system and endocrine system, which goes for a toss. Understanding a neuron, I don't need to tell you, so that's the reason I've skipped that. But understanding something that was skipped all these years is neuroglia, very important in disease formation in the nervous system. Oligodendrocytes, very important, most important. So most of the degenerative disorder that you see are because of the lack of the function of these dendrocytes, that is oligodendrocytes. Because demyelination is one of the core pathological issues seen in your old age and infectious diseases related to this system. Okay. Now, astrocytes by default, CNS का blood flow control करेगा, that's important. Microglia, phagocytic action, the soldiers, and ependyma. Ependyma, BBB, right? Briefly, very quickly, the most important brain mega networks. One is called the salience network. Second is the central executive network. Third is the DMN, that is the default mode network. Central executive is something that you are thinking, taking critical decisions, okay, analyzing that part. Then it runs from the frontoparietal part, okay, that network. Second is the salience network, okay, and default mode network. The default mode network is something that if you are at your own, no botheration, no work, no responsibility. What are you? That is called your default. It thinks about your future. It thinks about your current status. You go into a stance. All of that is default mode network. And a fine balance and a switch in between these two is maintained by the salience network. Okay, you'll find such similarities in Sigmund Freud's three-part mind as well. Okay, that is the id, ego, and superego as well. But this is the structural component. That was a physiological component. Then we are talking about the ventral and dorsal attention network, more responsible for you being attentive. For neuropsychiatry, limbic network, most important, which comprises of the amygdala, which comprises of the any other name that you know in the limbic system? Amygdala, and then anyway, we'll come to that. Then there is a sensory motor network as well. Language network, very important, language network and visual network. This is something which is a reticular activation system. What is reticular activation? So there are millions of sensory stimuli coming into the brain. Not all of them are allowed to go into the cortex through the limbic system. Okay, they are filtered. That filter, this is a larger meaning. Okay, the larger this filter and the one who decides which signals should go to which part of the brain is called the reticular activation system. ध्यान में रखना इसको, मन के बारे में इसके साथ relationship है. So what are the parts of the? This is what I was referring to. So you have what? The thalamus, the hippocampus, amygdala, and the limbic cortex. Anyway, this is anatomy that you already know. Primarily, these are more important. Okay, when we talk about the emotional regulation, when we talk about the regulation of our behaviors, these are the three switches. What are these three switches? Which will allow you to behave and to present yourself in a natural manner. One is the reticular activation system, second is the basal ganglia, third is the amygdala, which is the emotional control system. Then you have your key neurotransmitters, okay? Quickly running through them, acetylcholine, glutamate, GABA, noradrenaline, adrenaline, then serotonin, then you have dopamine, then you have oxytocin, and then you also have endorphins, right? And the images there tell you what it means. Now, the important part here is the last four, okay, starting from serotonin. These are your happy chemicals. These are your happy chemicals. आजकल सब लोग को happiness चाहिए, right? And then we say that oxytocin बढ़ाने वाला, okay, serotonin बढ़ाने वाला drug ले लो. Then you have SSRIs, right? What are SSRIs? Selective serotonin reuptake inhibitors, which are used in depression. That is, serotonin is not causing depression. Serotonin कम होना या serotonin does not do anything. Serotonin is just a messenger. It's just a person who's like a conduit. Okay. an agent. The problem is somewhere else. That's the reason SSRI से भी फायदा नहीं होता डिप्रेशन में. Okay, going ahead. I need you to know about this oxytocin. Okay, the oxytocin is called as the love hormone. So when we say love hormone, what does it actually mean? It is not love only related to genders. It is any love, which is a bond. It could be a mother and a child bond, a father and a child bond, the husband and the wife bond, the mentor and the student bond, okay, a friend and a friend bond. Why do I say this specifically? Because today you'll have a lot of Gen Zers who will come to you, millennials will come to you with only one problem or one root cause for their problems, which is loneliness, Okay, they don't feel the expression of oxytocin amongst each other. They don't have friends. They don't have anyone around them. Okay, and I'm not saying this hypothetically or only as theory. I'm talking from my experience with their interaction in all my clinical practice. So while we have neurotransmitters, it's good for us to know that we can draw some conclusion on how does Vat related to neurotransmitter, how does Pitta, and how does Kapha. Most of the or almost 95% and above of the mental health conditions could be attributed to Vat Pitta from a dosh perspective, and from a Trigunatmak perspective, it is Rajas and Tamas. Right now, with the various permutations and combinations, you'll have a broad spectrum of clinical presentations of this Manas Valley. Now, that's the reason you see in Charak and wherever we have encountered Manas Roga, we don't have a huge, what you say, compendium about Manas Roga the way that we have other diseases. There's a simple reason, because in Ayurveda, it is believed that it starts from a point of a normo-regulated emotion to an increased spectrum of disorders depending on various conditions of Vata, Pitta, and Rajas, Tamas. Okay, so there is no need for a differentiation between fear, psychosis, and anxiety, and schizophrenia, and bipolar, and Alzheimer's. There is no reason to compartmentalize them, but there is a continuity in each one of them. While modern medicine does say that if one goes from schizophrenic or a schizoaffective disorder to maybe bipolar, there is a tendency to move back and forth as well. Okay, so that's the very important perspective that Ayurveda offers in terms of how to deal with these disorders. So from a perspective of just to establish that confidence that you people need to have, that yes, our drugs which are supposed to be, say, Medya, okay, they are showing the relationship between the biochemicals as neurotransmitters are also affected by our dravya. Okay, that was the sole reason, but we come ahead on that. So the very fact that yoga is a life methodology, primarily making sure that you attain kaivalya. It goes to the marga of mana, right? Control of mana. It is proved that yoga boosts GABA. GABA is gamma aminobutyric acid, which is the cooler system of your body. It boosts also serotonin, that is your feel-good hormone. Okay, wellness hormone. Then dopamine, which is your reward system hormone, and it lowers the cortisol. What is cortisol? Cortisol is a stress hormone, or stress neurotransmitter. Now, you know what? The primary difference between allopathy, or you call it as today's reductionist science, and Ayurveda. I have mentioned it on another slide, just to make sure that you are able to relate to why this whole inclusion of psychology, and why this guy talking about psychology when we are talking about psychiatry is this. The approach, the therapeutic approach that Ayurveda has is psychiatry with psychology, okay, in today's world. And the therapeutic approach that modern medicine has is psychiatry without psychology. That makes a huge amount of difference in how we treat mental order disorders, how we understand mental order disorders. And in order for you to be comprehending that, I am talking about psychology as well. Because for you to understand adult behavior, you need to understand the conditions that that adult was when he was a child. That comes under the gamut of psychology. Okay, so it's most of the time it is missed by modern approaches. That's the difference between how an Ayurvedic neuropsychiatrist will work with patients as compared to an MD psychiatry who works with patients from a perspective of just knowing whether it is compartmentalized into maybe a schizophrenic disorder or a bipolar disorder and figuring out what is the medicine that I should be giving. That's it. And beyond which there is nothing called counseling. So a psychiatrist does not counsel. I wonder why. They send someone else for this job. And that guy does not know what the drugs are working on. That's a mess. Okay. So you need to know what is psychology from an adolescent, a child, an adult, and a geriatric standpoint. Geriatric छोड़ दो, आजकल कोई ध्यान नहीं देता उनके पास, but that's a huge science. But today's adult psychology is strongly adherent to what were the living conditions of that adult in his childhood, okay, which is very important. That is called as developmental psychology. So there are many factors, internal and external, events of nature, events of personal importance है, okay. So biological में है genetic, prakriti. Then there is sexual dimorphism as well. Male and females, they are predisposed to different types of conditions. Then external is environment. Again, here is Ayurveda concept. Family, Ayurveda concept. So you relate to Garbha Sanskar and Garbhini Charya with family environment. School and neighborhood. Music, culture, Sanskar, very important. Sanskar, very important. Events of nature and personal life. Now see how it is important. Now, when you talk about early childhood trauma, it is 15 times more possible for that child to get a mental health disorder. Early childhood trauma between the ages of 1 and 10. 15 times, that's a huge thing. Now see the relationship between early childhood trauma and foster care. When I say foster care, I mean the child is not with the parents in the early childhood. Okay, because you have a maternity leave which is not beyond say 6 months or whatever, right? Depression, 46%. Now, bipolar disorder, childhood trauma, 49%. Do you see a link between them? There is a difference in the susceptibility also. The ATS type of, there is more in males, ADHD more in males, intellectually compromised more in males, but related to depression, anxiety, more in females. Okay. Now, this is the basic apparatus of cognition. Okay, you have your indriya, which is going to your manas, sending the signals to manas, and based on that, your meda develops. Okay, you're building your schema. Okay, various components involved. Because this is a topic I cannot, cover in 45 minutes. I'll have to skip. Ayurveda relies quite a good amount on the Sankhya Darshan and Yoga Darshan, and your Panchvis Tattva Purush is something which is critical, right? That is superimposition of Purush, Prakriti, and then your Avyakta, and then so that's how your the Sattvic and the Rajasic component come into existence. So when we say Manuvasrutas, it is more of the connection from the heart and the links that we have between the the heart-brain axis. Spiritualism is important. Why, what, how? You have to think. But when it comes to spiritualism, it is your philosophies. One of the important philosophies is yoga. Yam, niyam, asan, pranayam, pratyahar, dharana, dhyan, samadhi. It's very difficult for us to go to anything beyond pratyahar in today's day. But even if you go up to pratyahar and dharana, that is good. Okay, very useful tools for neuropsychiatry, especially in the Satvavajay part. Now, this is something called the SCARF model, which is the cause of mental health illnesses. We'll skip this. Important for us to know is the prakriti, or in today's world, what we call as psychometrics, because there are certain people who are more prone towards certain types of illnesses, right? Especially when we know Manas Rog are related to Vata and Pitta. Excuse me for this. Then from a modern MBTI perspectives, you have various types, classifications. So the first one, analysts, are the people who are more scientific temper, wanting perfectionism. These are the people who are more prone towards. At the same time, you have the explorers. They are also more prone towards mental health disorders. Okay. One concept called post-traumatic growth, everyone has heard about PTSD, right? PTSD, post-traumatic stress disorder. But at that particular point in time, there is also called as post-traumatic growth, where you can target your patients to come out of PTSD and target the growth pattern. But for that, you need to be understanding the aspect of spirituality as well. That's the reason spirituality is important. Okay. Now look at the religiosity aspect of spirituality. Wherever there is high followerism in terms of religion, the spirituality is better. There is not clear-cut evidence in these cross-marked areas. How spirituality reduces your anxiety, stress, anger, depression. Okay. Most importantly, people who have less preponderance on the purpose of life, they are more inclined towards psychiatric disorders. What are the limitations? As I said, the approach is reductionism, and the therapeutic approach, the strike rate of medicines is less, the adverse effects are more, and dependency and withdrawal. Yukti Satvavajay is two parts. One is Yukti, which is multimodal design, and Satvavajay is enhancing your control. What control? Your control on yourself, right? So when we say Yukti, I mean to say it is designing of the medical therapeutic protocol. That is, what is your Shodhana and Shaman Chikitsa that you are planning? What is the diet that you are planning to? One of the samples that I do is it looks something like this. Is this visible to you?
Yes, sir.
Hello?
Yes,
Yeah.
sir, it is visible.
So based on the Vyadhi, the Dosh, Dushya, and the Sadhya Sadhyatva, at the same time, the age, the social factors, the family factors, we decide on multiple approaches. This is a typical one. I've just changed, or I've done the PIH removal. Rest, it is a patient of recent admission. November 26, we have admitted this patient. Okay. So we follow Dincharya procedures right from the mornings till the time that he finishes his dinner. You have multimodal approaches where you have music therapies, you have reading sessions, then you have guided meditation, followed by and accompanied by your sattvic meals, which are prepared based on the clinical condition of the patient as well. Obviously, this is concomitant to the panchakarmas and the upakarmas, which are found related in terms of their therapeutic efficiency for that particular patient, for that particular vyadhi. After discharge as well, we ensure that there is a follower. The patients follow some specific dietary principles. Okay, there are some general ahar vihar guidelines that we share. This is some very useful so that we give them a guideline for habits. We want to change their habits because one of the major reasons why you have mansik roga is pragyaparad. Not just mansik roga, any roga. Pragyaparad, right? Ati sevana, right? Or incorrect sevan. So you cannot tell them verbally and make them do it. So first I admit them, I give them the flavor, I make them use it every now and then, and I give them in writing so that they are able to practice that. Okay. So mindful eating, shadrasatmak ahar, right? Sleep habits, and then it is followed by a customized meal table for them. Okay. This depends on person to person based on prakriti, based on the current illness, and based on the Rutucharya as well, which Rutu we are going to do. So that's the diet part. I showed you the Shodhan Shaman part. Then we follow something called Sattva. What is Sattva Vajay? It's a non-pharmacological entity. And primarily it germinates from what? Yenendriya loka abhaya jaya. Abhava jaya. What is that? Indriya loka, abhava, and jaya. These are the important. So installing the self-command and mental strength to handle anything around. We don't want to change the conditions. The conditions will remain there. The stress will remain there. We want their soul, their mind, their, what you call it, to be able to sustain in that particular environment. So developing these coping strategies, understanding. So Charak has said in Manas Rog, there are two first things that you need to do. One is reassure to the patient. Second is jnana. Make him realize what the things are. What is he suffering from? What are the conditions that are around him? And how does he develop coping strategies? What are the tools? One of the tools is psychometrics. Second tool is emotional intelligence, mindfulness, yoga, music, diet, vihar. Then there are some important components that come into our picture, which is the behavioral therapies. So there are many versions. Okay, CBT, REBT hai. Then there is something called metacognitive therapies. Okay, we also have something called as social integration, because what happens is today's patients, they're full of anxiety due to loneliness, social anxiety because of social media explosion that has happened everywhere, and everywhere there is a false environment, there are false relationships, and people have gone, they garbled their whole life due to this falsehood of relationships. First case I'll discuss, not lengthy. Dr. Datta, do we have 10 more minutes so that I can finish these cases?
Sure, sir.
Okay, fine. I'm sorry for this delay. So there were many, but I thought this could be of interest to you. This is a 51-year-old guy who comes in with extreme fear of driving. So earlier he used to drive, he used to go for long drives, but right now he has extreme fear of driving. Would he hit someone? Okay, would someone come and hit him? Then he is also fearing to attend office meetings as well. Okay, and mind you, he is a guy from from the administrative services. He's taken some very bold decisions. He's done raids and all. Okay, so he's a very, very tough guy. But that tough guy, when he came to me the first day, I was like, shocked. This person can be like this. He had anger issues, loss of sleep, palpitations. He had premature ejaculation as well. He also had some lesions on his foreskin. He had GERD, he had fissure, he had social anxiety. And an incidental finding, I thought it could be there. So I did a random one. The first random was about 200, high fasting blood glucose. Then, because of all of this, his marital status is strained, and he is habitual to tea, more than 7 to 8 cups in a day, and more than maybe a packet of cigarettes. That is 20 cigarettes in a day. Okay. So what we did is we designed this plan, Purva Karma kiya, Panchakarma kiya usko, and based on whatever the Prakriti and Vikruti, we decided his Dravya, followed by Virendranath Chikitsa and CBTs as well. See, his fear and anger, 95% resolved. They were walking by my clinic, my daycare center, and his wife saw the board and they just walked in. They wanted an Ayurvedic part. They didn't want a modern medicine part. They had taken modern medicine earlier, for which he had severe adverse reactions, so they were afraid. Okay, so just walk in, and this was a result which was documented after 15 days after the Panchakarma was over. Okay, GERD had completely resolved. His anxiety had resolved. Okay, fear was too much under control. His wife had come and given all of these reports. The incidental finding, okay, Panchakarma, we did not make sure that only his blood sugar would be addressed. But see, on the days of Panchakarma, starting from 202, it has come down today. Last month it was 127. No specific efforts on giving an anti-diabetic drug. Ek dravya bolo ya whatever, no. Only in the last few days we had started. Okay. Case 2, this is a very typical case. And if I had more time, I would have, given much more insights on this. This is a post-encephalitis complication that we had in a 38-year-old female who came to me with complete disorientation. Okay. I'm talking something, she's not able to understand what I'm talking. Okay. She's not able to give me answers. More than 50% of the time, she can answer me when her husband used to prompt, this is what the question, and he used to tell repeatedly. Okay. Physically, she is fine. Okay. Healthy, around 5.7, 5.8 height. Educated, working in a government office. there is loss of orientation, difficulty comprehending words. You give anything to read over the दिखता ही नहीं मेरे को. There is, the words are jumping here and there. She cannot see that. There is loss of memory, both short-term as well as long-term memory, and a strong history of constipation. So MRI showed CVA changes which were earlier done. There was a history of seizure in her child. Okay, so we designed Yukti Satvavajay for her, and we continued CBT. And then over a period of time, we designed a Virendranath Chikitsa for rewiring of her demyelination. Today, as we see her after probably 11 months, okay, her original symptoms have gone. I was happy about her orientation and her reading. She is today writing and reading with a great amount of accuracy. She is able to go back to work now. She is able to go back to work. And we did not do, our Satvavajay did not stop only as medications, only as talking. No, I had gone to the extent of making her differentiate between va, fa, ka, and then forming words, and then forming sentences, and then comprehending them and writing essays. So that was a daily exercise we had given. She used to follow up at least twice in a week with my assistant to work on that part. So we worked on this area, the left side, Broca's area as well, the vernix part as well. Okay, not directly, but trying to stimulate that along with adaptogens and synaptogenetics that we had used in our Ayurvedic concepts. That is case number 2. We have a product which is called as a brain booster package, especially meant for students who are appearing for high profile examinations like the boards, the entrance examination. This is a 16-year-old female who came with headaches, dizziness, difficulty concentrating in studies, loss of confidence, and fear of exam. Okay, she had low scores as well in the past. On the left-hand side, bottom, I have put the complaint that the dad had given. She said when she used to use her mobile for studies, she had some episodes where the whole thing was revolving around her. Okay, and she was feeling restless at that time. She started crying. This episode lasts for 5 minutes typically. Okay, we started with the brain booster program. Okay, and this brain booster program has multiple things. There are 2 versions, the Ultra and the Pro. The Ultra has Nasya Shiro Abhyanga Medya agents, calming agents. There are sessions of counseling done by me personally, and they include at least 6 different counseling types. And then there is a study methodology also given to them. How do you study? See the response. औषधे घेतल्यानंतर तिला आता परत तसा त्रास झाला नाही, त्यामुळे रडू येत नाही, भीती किंवा एन्झायटी वाटली नाही, कॉन्फिडन्स पण वाढला आहे, तिची झोप ठीक, अभ्यास ठीक होतोय. And see the scores. She is ultimately admitted to one of the prestigious colleges in Pune for engineering, which was her dream. So in neuropsychiatry, in Satvavajay, we don't stop at just giving medicines and giving lectures. There is another patient who is right now following up with me, and she has failed in one of the examinations in her final year engineering. Okay, and she came up with this issue and not able to concentrate hardly 1-2 महीना रह गया. How do I study? So this is a plan that I had given her. Whatever is there flashing in the screens, this is a plan that we prepared based on her input. Out of the chapters that you have, that is 6 chapters or chapter 1 subject, what are the chapters, rate them in terms of difficulty and in terms of how lengthy they are. After I took that inputs, these 6 chapters, I formulated them in a particular timetable and shared it with her. So that's what is called as holism, is what I feel, that we take care of the patient in toto, give them back to the society in a manner that they should perform as a unit of the society. That's all I have from me. I'm sorry for extending the session if I have.
Thank you, sir. So now we are open for question answer session. So we have received some questions. So first question is, how we can treat schizophrenia, bipolar, and manic attacks? Any case studies? How can you brief?
Yeah, there are case studies with schizophrenia as well. Manic attacks, panic attacks are there right now. One patient we started with Purva Karma today. Incidentally, that patient is also a doctor. She is getting admitted on Sunday. And I typically I've handled this type of situations early. ऐसा questions बहुत आता है, okay, कि मैं इसको कैसे handle करें. Understand the logic and not the content of the answer. Okay. If I tell you use Tagara or use Sarpagandha at so and so milligram, that's a nonsense answer. You don't have one particular drug for one particular case. You have to understand the background of the patient. You have to understand the prakriti of the patient. Okay. You have to understand the reason why there is a panic attack. Second, schizophrenia. Schizophrenia is in Ayurveda. There is nothing called schizophrenia. Where is there schizophrenia? Nothing. Schizophrenia is a stage where there is delusions. There are cases where there are hallucinations, and the person is not in his own self, in his or her own self, and there may be cases of mania as well in that, right? So there is a schizoaffective disorder as well. You have to understand from a dosh perspective, from a hetu perspective, what are the things that have contributed. One is a contribution. Second is the large part is why in the first place it is there. Then you decide your therapy. So a lot, and I'll tell you what, whatever amount of medicines would contribute, more than that, your observation of the patient, your talking to the patient, your enlightenment aspect towards the patient will work more than only giving you, say, give them Mahakalyana Gruta at 15 ml for BID after meals with warm water for 3 months and give this. That does not work. Okay, so I would rather not want to answer these questions कि इसको कैसे handle करेंगे उसको तो क्या होगा. It is not a singular answer. It has pluralistic background to it. So let us not go to that way itself, because Ayurveda does not work in that fashion, is what my belief is. I may be wrong, so you may want to correct. I can accept your doctrines as well.
Thank you, sir. So next question is, many patients are drug dependent. Can we avoid their drug dependency on modern medicine?
Yes. So the question, again, it relates to the first answer. Why is there a need for a person to take something? And that is a support. That something is a support. He needs support. And do you find an 80-year-old guy being a drug addict? No. You'll always see in a specific age group. Why do you see that in that age group? Because there is something missing in that age group. There is something extra in that age group. We need to identify that. The purpose of that age group and the expression of that age group is not understood by the preceding generation, that is their parents. Okay, there is loneliness. Okay, there is failure. There is less of coping mechanism, most importantly. These are psychiatric cases. It is not an addiction problem. It is a manas rog. Treat that manas rog, the support required is not less. कितना हम लोग ने अल्कोहल का withdrawals कर लिया है, with the condition that I have counseled patients in a bar. I have told them, go in a bar, order a drink, don't drink it and start talking to me. ऐसा हम लोग ने मल्टीपल बार किया है, मल्टीपल टाइम्स किया बार में उनके साथ. मैं बार में नहीं, मैं मेरे क्लिनिक में, वो बार में. And then over a period of time, they order just Coca-Cola or something and they talk to me. And over a period of time, वो घर में बैठते हैं, मेरे से बात करते हैं. They don't need anything. I'll tell you, today's generation or people who are addicted, they don't need it. They need a support line, someone who can understand them, someone who they can feel is secure. मैं बात कर सकता हूँ. So today there are so many patients who outside of Maharashtra, they called me at night times 2 o'clock, 3 o'clock. They don't want to share it with the parents. That's important. And I want us to understand, we need to give a wholehearted support, but not a wholehearted advice. Advice देना है तो scientifically correct advice देना, support full देना. So it's possible. Our medicines also help, and more importantly, it is CBT, REBTs will help them more. You need to be in touch with the patient. That's why psychiatry does not help. Modern psychiatry does not help de-addiction. Okay, it is not just putting one drug which acts like an antidote. It doesn't work. Okay, बाद में वो inner urge आता. It's about how do you quench that inner urge to take support. Okay, give that support temporarily, then make him independent. उसलिए Satvavajay, that is, give his inner strength a next push to the level that he can take his own decisions and find a coping strategy to manage any stress in life. Did I answer you?
Yes, yes. So next question is how Ayurveda combat chemical imbalances in brain.
So I answered it while I told you neurotransmitters are not the ones who are creating the problems. Neurotransmitters, like for example, is IL-10, IL-12 creating inflammation? Is a cytokine storm reason for an infection? Is cytokine storm reason for COVID? No. Cytokine form is a expression of the severity of the infection. Likewise, neurotransmitters high or low are an expression, a chemical expression of my mental status. So there is no Ayurvedic way to. So this is something that we need to understand. We don't need to see Ayurveda correcting the markers of something. We need to see Ayurveda correcting the conditions, not the markers of conditions. Yes, if you treat the condition, the markers will go down or go up depending on what you're talking about the marker is. Did that help you?
Yes, yes. So we have a lot of questions, sir. Next question is how we can choose different kalpas in psychological disorders, like when to use Brahmi Grut, when to use Mahakalyana Grut, any avastha or any specification as per your clinical experience.
See, what happens is, if it's a gross pathology which is there for a long time, okay, first think of Shodhan. Okay, first think of Shodhan. Shodhan होने के बाद उनको आप normal state में रखिए, but that Shodhan has to be accompanied by even your counseling as well, right? Counseling is not the way that today's counseling is done. Counseling is that you have to give them a coping strategy. कोपिंग स्ट्रेटेजी के साथ दोष आप ठीक कर रहे हो, दोष ठीक करने के साथ आप उनका सत्व और रज और तम को भी कंट्रोल कर रहे हो बाय मेकिंग हिम डू सर्टेन थिंग्स लाइक माइंडफुलनेस है, इमोशनल। एक बार वो कर लिया, देन व्हाट इज द हेतु ऑफ योर ट्रीटमेंट? इफ द हेतु इज रिलेटेड टू द लॉस ऑफ मेमोरी, सिलेक्ट ड्रग्स विच आर रिलेटेड टू योर मेमोरी एनहांसर। जैसे ब्रह्मी है, वो मेमोरी एनहांसर है, उसको यूज करिए आप। ओके, When will you use माँ कल्याण घृत? सो अंडरस्टैंड माँ कल्याण घृत का हिस्ट्री, कहां पे ये यूज होता था पहले? ये पहले यूज होता था गर्भिणी सूतिका चर्या में भी यूज करते थे इसको, राइट? नाउ व्हाट डज इट कंटेन? हाउ डज इट वर्क? सो इट इज एन एक्सेलेंट agent which works in the HPA axis, that is your hypothalamus, pituitary and adrenaline axis. So in what conditions will it work? Right? It will work whenever there is a cortisol का problem, वहां पे आप यूज करिए। सारस्वत अरिष्ट कहां पे यूज करोगे आप? इट्स अ बेस्ट मेध्य अरिष्ट, इट इज कमिंग अंडर द क्लासिफिकेशन ऑफ मेध्य अरिष्ट। तो आपको जैसे स्टूडेंट है, ओके, आपको उनका मेमोरी यूज करना है, इंप्रूव करना है, बिकॉज यू हैव शंख पुष्पी इन दैट, राइट? It is a Vatagna drug here. It is anxiolytic. So our brain booster contains all of that. So depending on why do you want, where do you want, use it, and depending on the site, on the action. See, Ayurvedic drugs are excellent nanomedicine particles which are delivered through what today we call as microsomal drug delivery system, which has two interfaces. One is a lipophilic and hydrophilic. So you have the capability of crossing certain barriers of your body to reach the targeted site as well. So decide whether you want to give Taila, or you want to give Ghurta, or you want to give just a Kvata or an Arishta. So our intent will decide what the drug will be and how it will be administered. Don't have a blanket statement for that, because I am of that opinion, because we design our dravyas in such a fashion that it can reach the target organ. जैसे अगर न्यूरोसाइकियाट्री में पक्षाघात भी है तो राइट साइड में आपका इन्वॉल्व है, तो आपके लेफ्ट ब्रेन को कुछ करोगे क्या? आप राइट को भी करोगे ना, राइट लेग को भी कुछ तो करोगे ना। और वहां पे कौन सा चॉइस ऑफ ड्रग है, चॉइस ऑफ मीडियम ऑफ ड्रग है, दैट इज योर तैल। एक तो वात है, राइट, दूसरा स्किन है, and even consider your skin microbiome also for that matter. You need to understand skin microbiome और स्वेदन। स्वेदन क्या करता है स्किन माइक्रोबायोम को? नाइट्रिक एसिड का बारे में क्या है, नाइट्रिक ऑक्साइड के बारे में क्या काम करता है, How does it change? How does porosity increase? How is the absorption of your Vatagna drug increased with your Swedan? फिर बस्ती सिलेक्ट कर रहे हो आप, तो बस्ती में व्हाट आर द इंग्रेडिएंट्स, व्हाई डू यू नीड मद इन दैट, हनी क्यों चाहिए उसके अंदर, सैंधव क्यों डालते हो आप, राइट, कितना बार उसको ये करना है, व्हाट इज द पार्टिकल साइज दैट इज अटेन्ड, ये सब सोच के आप जब करोगे ना, तब आपका आंसर अपने आप आपको मिल जाता है. So grossly, Medhya Rasayan will be in general, tonic, brain tonic के जैसे. I usually don't like this word because it is non-existing terminology, tonic. But you can call it as you can enhancing the memory. Okay, Medhya. दूसरा है वो एंग्जियोलाइटिक ग्रुप्स में आप शंख पुष्पी का डालो. ओके, एंग्जियोलाइटिक इसमें कामदूदा का डालो, राइट, बिकॉज यू नीड टू अंडरस्टैंड द वॉलेटिलिटी and the expression of anger also relates to your pitta component, right? Sooth shekar ko samajho. Okay, if there is a pitta element and if it is also accompanied by dysbiosis, leaky gut, as I showed you some time ago, think of purpati kalpa also. It's not just, so if you have something related to your gut dysbiosis and you also have a psychiatric disorder, you cannot have a psychiatric disorder treatment without treating your gut microbiome, because the gut brain axis is again still bad, right? तो आप परपर्टिकल पे यूज करिए या फिर एनीथिंग, बिकॉज इन आईबीएस यू विल ऑलवेज हैव दैट. एंड बस्ती आल्सो रिलेट्स टू योर एफएमटी, दैट इज fecal microbiome transplant, which is used in autism as well, which is also started they have also started using in mental disorders like anxiety disorders as well. Too much, right?
No, sir. It is many more to come from you, sir. So next question is your insights on Atatva Binivesh.
So I want someone to who has asked this question.
So this is the pre-question we had received before your session started.
Okay, so is it possible that someone can just tell me what is Atatva Binivesh? Because there lies the answer. Very good question. कोई भी बोलो ना, डोंट स्पेंड टाइम, ऐसी बोलो, जस्ट एक दो वर्ड्स बोला तो भी चलेगा.
विश्वमा कुरुते बुद्धि नित्य नित्य हिताहिते अततो अभिनितमो रक्तमागलम.
मुझे कुछ नहीं समझा. So what it means is, in short, it's related to I am not oriented to one place.
So it's sort of a delusional state of a mind.
Exactly. I am not oriented to what is happening around me. I have my own world, which is unmad. It is a false perception. False, but understand. False in what concept, what context it is? False in the context of the understood normal people. Understood normal people जो है, उनके हिसाब से एक बंदे का perception of reality is altered, but that person thinks it is real and all of you are pagal. Right? Now for you, what is it also where it's seen? It is seen typically in schizophrenia and advanced cases in that spectrum, where you also have bipolar, you have multiple different formats of that. How do you treat that? In modern medicine, in today's psychiatry, the last resort is what? Give them a shock. You put all the waves into zero and then again reignite them, the way that you do a cardio version, right? But here our panchakarma works excellent. But there was one case which is around a 26-year-old lady who hailed from the western part of the Western Bengal, and she had come here and from an upper class society, and because of a history of ECT along with early exposure to drugs, to mobiles, so she was and she used to live in an old world. Okay, now this was complicated with the type of personality that she had. ENFJ is something INFJ. Now these type of people are born with the trait, with a feeling that I am right all the time. They may be partially narcissistic as well. Okay, now when these develop, atatvabhinesh, or these develop a tendency to live in a false world, then it becomes a difficult combination. That is the time you have to think about sadhyata. Okay, it is a sort of a krutya sadhya status. Now, how do you treat them? You have to give chikitsa, which is related to vata, which is aggressive. Okay, there is nothing called a shock that we can give, but your CPTs and REBTs will deliver that shock. It has to be in a controlled environment, and at the same time, a combination of your ahara will make sure, and it will be more towards enhancing the kapha element, and working on the vata element, vatagna dravya, such that there is calm and peace. In that case, you will have so many other elements like Shankha Pushpi, as I said. The Mahakalyani group plays a good part there in controlling the HP axis as well. Did I answer you?
Yes, sir. So next question is what to do any BMS doctor if he or she wants to open psychiatric clinic as super specialty?
See, one thing is for sure, you are already qualified to practice neuropsychiatry. BMS course is designed in such fashion that you can practice neuropsychiatry, right? Because it is a part of our curriculum, so why not practice it? If I take my example, after I did this, I did one of the courses from the Dukes, which is medical neuroscience. And I got an opportunity to teach medical neuroscience and cognitive neuroscience at University of Mumbai as a visiting faculty. At the same time, teach neuroscience in design at Lake Jagran University at Bhopal, Madhya Pradesh. Then I used to be, working in multi-modal studies related to psychiatry and gut microbiome. So I have my training courses, if you visit my site, you'll get to know, which are more concentrated on gut microbiome, more concentrated on connection of Ayurveda with reductionist science, and how do you extract meanings out of the patient's clinical conditions with the modern terminology, but applying Ayurveda. At the same time, I also have had chances working with the West. So I was in the US for some time working in large hospitals, 500 plus bedded hospitals, especially in the psychiatric element. And that is where I got some insights on why Ayurvedic psychiatry works best. So follow today's research methodologies, follow all articles related to neuropsychiatry, not just in Ayurveda. It is going to cripple you. You have to know all the biochemistry involved in nervous system, all the anatomy involved in nervous system. That is the time you get to know kitna deep hai Ayurveda or kitna superficial hai reductionist science. Only then you will be able to start training and treating patients. Then learn online. There are so many resources. I have done, as I said, medical neuroscience. You can do so many other courses. You can do courses on counseling as well. But understand one thing: to become a psychiatrist, from an Ayurveda perspective, you have to be a combination of a psychiatrist and a psychologist. Becoming a psychiatrist is easier. Become a psychologist is very, very difficult. You have to first understand life. You have to go through that. It's best if you have undergone some of the psychiatric illnesses. Unless and until you know what is the pain in anxiety, you know what is the pain in mania, you know what is the pain in depression, it is very difficult to first read that patient in the first place and then give them a likewise. So I don't mean पहले आप बीमार पड़ जाओ फिर कर लो, but that is also going to help you.
Thank you, sir. So next question is how can you correlate role of Shukra Dhatu in mental health?
Wow, so mental health का सबसे बड़ा प्रॉब्लम होता है रस धातु. बराबर है? And that's the reason there were so many contents that I had in relation to leaky gut as well. Rasa dhatu is the first place. If you have an altered rasa dhatu metabolism, you are bound to have some issues. Right? And rasa dhatu uttar, if you are not able to control the metabolic fire of all of this, your shukra dhatu is a problem. Now, one more element which modern medicine has agreed and studies have proved, now it's very critical for you to understand this point. Consider I am a 30-year-old man. I am going to marry. Okay? And I am under a huge amount of stress. इतना स्ट्रेस कि उसने मेरे को हाइपरटेंशन दिया है, रात को जागता हूँ, नींद नहीं आती, कुछ पसंद नहीं आता खाना, कुछ रात को 3 बजे उठ के मैं कोक पीता हूँ बिकॉज ऑफ द स्ट्रेस, वर्क स्ट्रेस और वट एवर स्ट्रेस, रिलेशनशिप स्ट्रेस. And then I'm going to get married in the next 6 months. I have a case right now we are handling, for which we have a product also which is called as Bandhan. I'll tell you later about it. But ये लोग है ना, if I am a guy stressed with so much of severe problem, there are going to be epigenetic changes in the sperm. I'll share that link with you if you want that research paper. With those change in epigenetics that caused by epigenetics, there is a higher chance, and it is proven that the children who are born in this phase of your life are having mental disorders. Not because of the child, it is because my sperms, the man's sperms who is going to marry, but years previous to getting married, there are epigenetic changes that have happened in not years, but few months, whatever. Because the number of sperms, it's not limited. In a mother, what happens? There are limited number of ovum, they are dispelled. Epigenetic changes are there in the male. And neuropsychiatric related changes are there forever. Unless he changes himself to a healed person, there will not be any difference.
Thank you, sir. Social media as a manas hetu in today's era. Please share your thoughts that doctor should take this in consideration.
Yeah, you have to take care of this because, as I said, when you want to be treating neuropsychiatric illnesses, everything comes under the purview. खाना क्या खाता है, सुबह कितना बजे उठता है, so your consultation time, be ready for not seeing more than 10 patients in a day. अगर उतना दम है तो साइकेट्री में आना. 10 भी मैं ज्यादा बोला, because in one consultation you will have to end up spending at least 90 minutes minimum. So yes, social media is an important part. And what I do, after I see a patient or even before I see a patient, when I get to know ये patient आने वाला है, मेरा टीम और मैं पहला उनका social profile देखता है, social media profile देखता हूँ, उनका LinkedIn profile देखता हूँ. What I get to know what is the position in this office, in his working place. I get to know how much amount of stress it would be. I get to know his involvement in social media. I get to know वो कितना बार बाहर जाता है, कितना खुद के लिए breaks ले रहा है, नहीं ले रहा है. I get to know his likes and dislikes. I get to know how much is he pervasive, is he pursuant to fraud happiness. So you get a huge amount of stuff from him. And the way that he reacts will also allow you to design that. And social media does exist as a major cause for anxiety. And today's social anxiety is not about meeting people in public, but how do I handle my social media as well? How do I see someone else's post and how do I react? Why do I react to it? One of my recent podcasts talks about the same thing. So it's very important. You need to make sure that there are restrictions. So whenever patients get admitted at my place, yes, there is a free Wi-Fi, but we don't allow mobile phones there.
Thank you, sir. Now we are here stopping the question and answer session. Now we are moving to our chairperson's view. Sir, can you please close from your side the slides?
Yes.
So it is my honor to introduce our today's chairperson. I welcome Dr. Virendranath Tiwari, sir. Dr. Sir has done BMS and MD from KJ Mittal Punarvasu Ayurveda College, Cherney Road, Mumbai. Sir is ex-HOD and professor in Panchakarma department at YMT Ayurveda College, Kharghar, Navi Mumbai. Sir is MUHS approved PG and PhD guide. Sir is vice president of Vishwa Ayurveda Parishad. Sir is a member of NAPAR. Sir is a member of NEMA. Sir is the ex-president of Antop Hill Medico Association. Sir has published 20 research papers and various papers presented in national and international seminars. I request Dr. Virendranath Tiwari, sir, to please guide in brief. Over to you, sir.
हेलो, मेरी आवाज आ रही सर जी?
यस सर, यस।
सबसे पहले तो मैं द गुरुकुल ग्लोबल एकेडमी के सभी पदाधिकारियों को धन्यवाद देता हूं। साथ ही डॉक्टर दत्त बापरडेकर जी को धन्यवाद देता हूं कि जिन्होंने इस सेशन का चेयरपर्सन बनाने के लिए मुझे मौका दिया। आज का सेशन बहुत ही सुंदर रहा। डॉक्टर कदम सर ने एनाटॉमिकली और यानी मैं कहूं तो मानस रोगों के लिए और मस्तिष्क की संरचना के ऊपर बहुत ही विस्तृत ज्ञान दिया है और बहुत ही सही तरीके से अपने विषयों को रखा है। और इस तरीके के जो सेमिनार्स हैं उनके लिए ये समय की जो लिमिटेशन रहती है समय की, वो जरा कम पड़ जाती है। तो इस प्रकार के सबसे पहला तो मेरा सुझाव ये है कि इस प्रकार के आयोजन बार बार होना चाहिए और लोगों को समझ में आना चाहिए। आज के सेशन को की सफलता के लिए मैं भगवत गीता के 16वें अध्याय के 21वें श्लोक को समर्पित करना चाहूंगा, क्योंकि भगवान कृष्ण ने बहुत सरल तरीके से सत्वावजय चिकित्सा का सूत्र बताया है। त्रिविधम नरकस्येद द्वारम नाशनम आत्मनः कामः क्रोधः लोभस्तथा तस्मादेतत् त्रयम् त्यजेत्। भगवान कृष्ण ने बहुत स्पष्ट तरीके से कहा है। और आज के समय जैसा कि हम लोग देख रहे हैं कि हर 7वें आदमी में से एक आदमी मानस रोग से ग्रस्त है, अनिद्रा से ग्रस्त है, डिप्रेशन से ग्रस्त है, अवसाद से ग्रस्त है। उसका एकमात्र कारण है जो मेरे समझ में आया है कि ओवर थिंकिंग। अभी सर ने मस्तिष्क का इतना अच्छा वर्णन किया है कि व्हाई डू वी नीड ब्रेन। अरे ब्रेन हमको भगवान ने दिया है सकारात्मक सोच के लिए। बहुत ही सुंदर संरचना दी है भगवान ने, सकारात्मक सोच रचनात्मक कार्यों के लिए दी है, लेकिन हम उसका सदुपयोग ना करके ओवर थिंकिंग करने लग गए हैं आज के समय में। इसलिए सबसे पहले तो हमको अनिद्रा से हम ग्रस्त हो जाते हैं। बहुत ज्यादा नहीं बोलूंगा, लेकिन जैसे ही अनिद्रा शुरू होती है तो अनेक प्रकार के मानसिक रोग और शारीरिक रोग हमारे शरीर में अपने आप आ जाते हैं। जैसा कि अपने आयुर्वेद शास्त्र में कहा है कि निद्रायत्तम सुखम दुखम पुष्टि कार्स बला बलम क्लिबता च। अभी लास्ट में क्वेश्चन भी आया था। तो हम अपने प्रैक्टिस में अगर थोड़ा सा रोगी को शुभ संकल्प करने की आदत लगाएं, ईश्वर पर दृढ़ विश्वास रखने की आदत लगाएं और आत्मविश्वास जगाएं। और सबसे जरूरी है कि आज के समय में सुबह उठते ही अपने काम की हम प्लानिंग करें। सुबह उठते ही काम की प्लानिंग कर लें और उसके हिसाब से अपनी दिनचर्या शुरू करें, तो बहुत सारे मानसिक रोगों से हम बच सकते हैं, अपने रोगियों को बचा सकते हैं। और उनको हम, जैसा कि आयुर्वेद में सत्वावजय चिकित्सा, युक्ति व्यापाश्रय चिकित्सा, दैव व्यापाश्रय चिकित्सा, जो 3 प्रकार की चिकित्सा बताई है, उसमें एकमात्र सत्वावजय चिकित्सा, सत्व अवजय यानी मन के ऊपर नियंत्रण करने की चिकित्सा है। किसी प्रकार की औषधि का उल्लेख नहीं है इसमें। लेकिन युक्ति सत्वावजय चिकित्सा जब हम करते हैं, आज के समय आवश्यकता है जिसकी, तो युक्ति पूर्वक औषधियों का प्रयोग करना, जैसा कि अभी कदम सर ने सारस्वतारिष्ट का बताया, ब्राह्मी का उपयोग बताया, उसका उपयोग करके हम मस्तिष्क को कार्यक्षम, तनाव रहित रख सकते हैं और रोगी को अनेक प्रकार से कि अन्य औषधियों के दुष्परिणामों से बचा सकते हैं। तो इस अगर पूरी तरह से मैं कहूँ तो कार्यक्रम बहुत ही सफल रहा। कदम सर का व्याख्यान बहुत ही उपयोगी, ज्ञानवर्धक रहा। मैं उनको बहुत बहुत धन्यवाद देना चाहता हूँ। और इसी प्रकार से वो चिकित्सा के क्षेत्र में रोगियों को स्वास्थ्य लाभ कराने में सफल हो, यशस्वी हो, और जो आयुर्वेद के अध्येता हैं उनके ज्ञानवर्धन के लिए प्रयत्न करते रहे, काम करते रहें। मैं एक सुंदर लोकोक्ति के साथ में अपने वाणी को विराम दूंगा। अतीत एक सपना है, भविष्य एक कल्पना है, और वर्तमान ही हमारा है। इसको हम अपने जीवन में भी उतारें और अपने जो रुग्ण हैं उनको भी उनके जीवन में भी उतारने का प्रयत्न करें, तो हमारा ये सेशन बहुत ही उपयोगी और सफल होगा। एक बार मैं हृदय से सबको धन्यवाद देता हूं और अपने वाणी को विराम देता हूं।
Thank you, sir.
धन्यवाद।
Let me know everyone that our session is sponsored by Virendranath. Moving ahead, Namrata madam, next. Now over to Virendranath.
So, very good afternoon to all of you doctors, and my respect to Tiwari sir, Dr. Cyril. So, again, greetings from Virendranath. So, I'm here to present you a few products that you can apply after thorough analysis of the patient. मतलब प्रकृति, देश काल सब एनालाइज करके आप प्रॉपरली अगर अकॉर्डिंग टू आपकी युक्ति आप ऐसे प्रोडक्ट्स मतलब डेफिनेटली ट्राई कर सकते हैं. सो there's this popular product of ours that is Pancharavinda Churnam. So Pancharavinda Churnam is basically made out of 5 parts of lotus, that is Pisam Kesaram, Patram Bijam and Padma Kandam. So as it is an Anupadravya, so it is very effective in managing Pitta. It has a very good Pitta reaction. So you can definitely use this combination in Pitta Jonmada, and it works very well with Saraswata Arishtam and Saraswata Ghritam. Okay, so dosage is 3 to 5 gram in general, and you can use it with milk or Ghritam. So next slide, Dr. B. And one more product that we have is Panchagandhadi Churnam, which is popularly recommended for insomnia conditions and sleep disorders specifically. So as Dr. Cyril mentioned, like most of the mental health or psychiatric patients will have this sleeplessness or insomnia as a key symptom. So to tackle this, you can use this Panchagandhadi Churnam as a lepam or Shiradhara. So as doctors, we are all aware what Shiradhara is. So next slide, doctor. Okay, I had left one more popular product of ours. See, in these days, what we have seen is there is a very much decline in use of Gritams. Popularly, there is Brahmi Gritam, then there is Mahakalyanaka Gritam. So when we go to the context of Unmada Chikitsa, you can see what Charakacharya says. Unmade Vataje Purve Snehapanam Visheshta. So majority of this Unmada, insanity or mania-like conditions, you will have this Vata aggravated. Vata along with Manodoshas like Rajas or Tamas. So you can definitely include Gritams like Panchagavya Grita, Mahakalyanaka Grita, and Brahmi Gritam specifically. So this Brahmi Gritam is an excellent Medhya Rasayana to be used in your clinical practice. So I won't take much time. I just had 3 minutes of time. So I wish to thank Dr. Dutt and the Gurukula Academy for organizing this in a very well manner, and to bring Dr. Cyril Kadam sir in this very good and informative session. And I would conclude my session here. Over to you, Dr. Dutt. Thank you so much again.
Thank you, sir, for connecting with us. Next. So let me brief about our upcoming courses, the Gurukul Global Academy. The certificate course in Integrated Oncology, Essential Pharmacology, Agniman Vida, Essential Rheumatology, Essential Nidan and Vikruti Vijnan, Essential Rasashastra and Bhaishya Kalpana, Essential Panchakarma, Essential Dravyagun Vijnan, and Therapist Panchakarma Training course. Next. We are soon starting from the 1st of Jan to 2026 certificate course on integrated oncology. These are our panelists. Next. So those who wish to join for this online certificate course in integrated oncology, they can contact on this number 9969 119134. You can either mail us or visit our website. The duration is for 3 months and the platform is online and lectures would be twice weekly. Next. We are also conducting essential pharmacology course by Dr. Nimish Narkar sir. Next. Essential Dravyagun Vignan run by Dr. Prajakta Bhatt and Dr. Swagata Tavre. Next. Essential Rasa Shastra and Vaishya Kalpana by Dr. Madhav Bide sir and Dr. Ketki Bide madam. Next. Rog Nidan Vikruti Vignan, Essential Nidan and Vikruti Vignan by Dr. Anish Pandit sir. Next. Essential Panchakarma will be guided by Dr. Monika Mure madam, Dr. Ravi Bhushan Sonamne sir and Dr. Deepali Sawan madam. Next. Essential Rheumatology course. Next. Basic life support. This would be the offline hands-on training by Dr. Abhijit Kore sir. Next. Therapist Panchakarma training course. This is specifically for therapist. Next. This is online plus offline plus hands-on training plus internship. This is run by the Gurukul Global Academy and the session will be started soon. Next. Our upcoming clinical meeting would be on 18th of December. The topic is clinical case series on the non-surgical management of lipoma. Our guest speaker is Dr. Rucha Pai madam. Next. We will start our new year with on the 1st of Jan. The topic would be various cases of Vat Rakta in day-to-day practice. And our guest speaker would be Dr. Santosh Mahadik sir. Next. Now we are moving to vote of thanks. Over to Dr. Nikita Vikhande madam. Over to you, ma'am.
On behalf of my team and Partner Specialty Clinics, I am sincerely honored to deliver the vote of thanks. I extend my heartfelt gratitude towards Dr. Cyril Kadam sir for sharing his valuable insights and our chairperson, Dr. Virendranath Tiwari sir, for his presence and encouragement. A special thanks to Vaidya Ratnam and Ayurveda Kalpashala for their valuable contribution. A sincere thanks to in charge Dr. Datta Bapadikar sir for leading this session. A special thanks to the founder, Dr. Bhalchandra Mahamuni sir, for constant support and guidance. A sincere thanks to the technical support team, Ms. Namrata ma'am and Mr. Yes sir, for seamless coordination. Thank you everyone for making this meeting a successful one. Thanks once again.
I declare that our session is concluded. Stay connected with the Gurukul Global Academy. Thank you. Thank you all.